Okay, good afternoon all. Today we are going to see about the preoperative care during gynecological minor and major procedures. Okay, that's the first we can see the outline how it can be give preoperative care. So coming to the introduction, then preoperative evaluation. That is, we should collect the history, physical examination, anesthesiological examination, investigation, preoperative preparation. Then coming to the introduction. Preoperative care is the preparation and management of patient prior to surgery. Before doing the surgery, we are giving the care. It includes both physical and psychological preparation. We should explain the procedure. What's the physically we are doing to do same and give the psychological support. Surgical treatment of the patient with gynecological diseases is warranted only when all the conservative treatment approaches have been exhausted. That is the surgical treatment of the patient with the gynecological diseases is warranted. We will be advised that is warranted giving that only when all conservative treatment approaches have been. So we should do all the treatment approaches are fully finalized, and we can note the final thing is only the we should do the surgery. Then many post-operative problems can be anticipated preoperatively and eliminated or minimized. We are giving the accurate care of preoperative care, we can be avoid the post-operative problems. Timely giving the preoperative care. There are two groups of indications for gynecological surgery. Absolute, when the surgery must be undertaken when its cancellation is life-threatening. Relative, when surgery can be postponed till the past appropriate occasion to be performing. Then the surgeon is obliged to introduce to the patient all the reasons of surgical treatment. Then informed consent. The patient must submit an informed written consent to confirm that she takes the risk of planned surgical treatment. Discussions regarding consent should be held with a qualified interpreter present. Then presence of an interpreter should be included in the documentation. The informed consent decision should include the following, that is the rationale, complications, unexpected findings at surgery, personnel who will be involved in the surgery and documentations. Then preoperative evaluation. While doing the preoperative care, what will be the evaluate? Used to address issues that will potentially affect the woman during the surgical procedure and recovery. The surgeon should use this type to review the patient's history, physical examination, identify physical limitations, gather information required to plan surgery, optimize medical status, and educate about what to expect from the procedure and during recovery period. And patient history. A comprehensive history is the first step, helping surgeons to determine the scope of general physical examination, laboratory and radiological test. The patients undergoing minor surgery can be examined by their surgeon and anesthesiologist on the operation day during preoperative preparation. And those with the more serious condition should be examined at least a week before surgery, allowing the time for risk assessment, specialist consultations and preparations. Then general medical history, we should include personal and family diseases, history of drug disease, allergies of drugs, foods and other environmental allergens, hospitalizations, early diseases including the previous operations, tolerance and anesthesias. Important family data refer to malignancies, CVA, CVD, diabetes mellitus, cerebrovascular diseases and osteoporosis. Then gynecologic and obstetric history should contain the data about major complaints of the current disease, beginning, duration, symptoms, past pregnancies, description of each duration, complication, type of delivery. And menstrual cycle data, intervals, duration, copiousness, dysmenorrhea, premenstrual syndrome, intramenstrual bleeding. Then menarche, date or the last menstruation. If the patient is the age of menopause, recent vaginal bleeding, vasomotor symptoms, hormonal replacement therapy. Then birth control. If sexually active contraception methods of the past is sterilized, time and mode of sterilization. Then sexual history, birth control, conception difficulties, infertility. Then infections, that vaginal discharge, previous vaginal infections, STDs. Then clinical examination, aim of physical examination is type physical health status in view of history and medical condition. Full physical examination is needed. Detailed exam of the abdomen, pelvis, and the component procedure. Then anesthesiological preparatory examination. An anesthesiologist has to examine the patient before her operation. Helps him to get an insight into the general health condition to assess whether the patient is able to tolerate the risk and duration of anesthesia of the planned surgery. A special stress is put on the basis of consciousness, vital functions of the heart, blood vessels, liver and kidneys. Anesthesiological surgical risk assessed based on the assessment of physical status created by ASN. Then group can be divided into 4 groups, that is the original disease without systemic impact, that moderate systemic disease without functional impediments, that severe systemic disease, then 4th severe systemic life-threatening disease, and 5th one morbid patient with 24 hours and 6 confirmed brain death. Investigation, preoperative indications of in laboratory test, patient age, diagnosis, then risk for procedure and careful history and physical examination. Blood group determination, complete blood count, leukocyte formulation, sedimentation, renal function tests, liver function, blood glucose level, general analysis. In the pregnancy test should do, that is the before surgery on fertile woman who would be pregnant. Imaging studies, biopsy tissue for diagnosis of suspicious. Imaging study includes IVP, CT, MRI, ultrasound, preoperative chest x-rays, and preoperative preparation. It is important to allow adequate time, correction of anemia, we should give iron supplementation, medical treatment, erythropoiesis, blood transfusion, then smoking cessation, that you should understand medical consultation and stabilization. For this all thyroid replacement, hypertension, CHD, diabetes. Then bowel preparation, that's the bowel should be that diet ended, we should be empty the blood bowel, then give the laxatives like that. And preoperative antibiotics, that is local immunity to infection, primarily surgical task. Single dose of antibiotic immediately before the operation, and take more than 3 hours. Administration of antibiotics. Then in time consuming intervention, intramuscular administration of antibiotics is preferred. Prophylactic use of antibiotics have been demonstrated to be more successful or vaginal. Adequate use of antibiotics is able to reduce. Then recommendations of choosing antibiotics: cephalosporins, metronidazole, clindamycin, ciprofloxacin. Thromboprophylaxis reduces incidence of symptomatic and types of thromboprophylaxis, pharmacological or mechanical. Then pharmacological prophylaxis include low dose ultra fractional heparin, low molecular weight, then aspirin, that is that. Then mechanical methods replaced in the patient just prior to start the surgery. Most commonly used methods of gynecological surgery are intermittent pneumatic compression boots, graduated compression stockings. Then patients, you can see just for awareness this all things has added. Then major gynecological surgery, benign disease with a No additional risk factors. Major gynecological surgery or malignancy. Patients who have undergone major surgery. And in conclusion, we can say that preoperative patient preparation for gynecological surgery to avoid, minimize both intra and post-operative complications, enabling successful and surgery. Okay, thank you all.